American Medical Systems presents Elevate Apical and Posterior Prolapse Repair System. Posterior wall incisions. Inject a local anesthetic vasoactive solution such as lidocaine with epinephrine. Perform a midline incision. Posterior wall dissection. Dissect down to rectovaginal fascia using a full-thickness dissection technique. Utilize blunt dissection technique to maintain dissection in the same plane. Dissect towards the ischial spine and palpate with index finger bilaterally. Clearing the sacrospinous ligament. Sweep medially 2 to 3 centimeters toward the sacrum to clear fascia from the ligament. Perform on patient's left and right sides. Place sutures in vaginal apex. 2 or more delayed absorbable sutures should be placed at the apex. To load the apical fixation tips, insert the needle into the self-fixating tip and then load the needle into the curved plastic sheath through the end with the cutout feature. Slide the sheath down until a click is heard. When loading the fixating tip, make sure it mates to the needle tip so that the tines are always in a vertical orientation. Locate the sacrospinous ligament by palpation. While keeping palpating finger on the ligament, guide tip of needle and sheath alongside the finger towards the sacrospinous ligament. Place sheath at fixation point, approximately 2 to 3 centimeters from the ischial spine. Press release mechanism and drive needle and tip into ligament. Remove needle and sheath from the area of implantation by pulling back gently until it disengages from the tip. Perform for both patient sides. Locate the loose eyelets on the graft and slide each over the fixating arms exiting the introitus. You may trim the proximal end of the graft according to the patient's anatomy. At this point, place previously placed apical sutures through the proximal portion of the graft. To position the graft, use the adjustment tool and slide over one of the fixating arms. Slide the graft towards the pelvic cavity in short increments on each side until the desired position is obtained. Once the adjustment of the graft is final, attach the female end of the eyelet applicator at least 2 centimeters onto the end of each fixating arm. Proceed to slide the locking eyelets down the fixating arm and into the cavity until it reaches the loose eyelet on the graft. Palpate to verify that the locking eyelet rests against the surface of the loose eyelet. Now, secure the apical sutures previously placed. Trim the fixating arms to a length of at least 1 centimeter extending past the locking eyelet. Posterior wall management. Absorbable sutures may be used for lateral fixation, 1 on each side in the levators, 1 on each mesh corner just superior to the perineal body. Perform perineoplasty as necessary. Minimize trimming of excess vaginal mucosa. Close with your choice of suture. Insert vaginal packing.